Good morning. I'm New York Assembly Member Pamela Hunter, NCOIL President, and I will be chairing this meeting today. I'm calling to order this meeting of the NCOIL-NAIC Dialogue. I will first entertain a motion to waive the quorum requirement. May I have a motion? Second. All in favor? Opposed? And now I'll entertain a motion to approve the July 18th, 2025 committee meeting minutes. Motion, please. Second. All in favor? Thank you very much. Before we jump into today's agenda, I just want to take a moment to thank each of you on behalf of NCOIL for being here this morning. Your continued engagement and spirit of collaboration really are the foundation of everything that we've built together throughout the past several years, so thank you very much. It has been another great year for our partnership, but there's obviously still much more work that needs to be done. And we are at a time where there just are really so many question marks as to what's going on in the marketplace and where it's headed for both the state and federal level. So it is important that we don't lose sight of this partnership we have and our overarching goals of supporting state-based system of insurance, legislation, and regulation. So with that, if you all, the commissioners who are here, if you could please introduce yourselves before we get started, please, with the agenda.
Well, good morning, everybody. My name is James Brown. I know what you're thinking, and the answer is I do feel good. That's particularly relevant in the state of Georgia. I'm pleased to be here for that. Was elected Montana's insurance commissioner in November of 2024, so I've been on the job 11 months, my first NCOIL meeting. So thank you for inviting me.
Thank you. Welcome.
How do you top that? I'm Glenn Mulready. I am ready. Oklahoma Insurance Commissioner, good to be back with y'all.
Thank you.
So I'm Michael Jackson Cheney. Thought I'd bring that up. Mississippi. I don't have his money, though.
John King, Georgia Insurance Commissioner.
Good morning, everyone. I'm Patty Cooterer from Washington State. I was also elected in November of 2024, so I've only been on the job for a little over 10 months and really enjoy the hospitality here. I want to thank Commissioner King and the NCOIL Chair and Vice Chair President, I should say, for bringing it to a state I had not had the opportunity to visit yet. So thank you.
Thank you. Thank you all for being here. Let's first discuss the NAIC. Oh, I'm sorry. Glenn. I'd like to give you a couple moments, please.
Good.
Sorry.
Thank you. I just wanted to take a minute to say thank you and I guess sort of echo your comments about how grateful we are for the collaboration and the relationships that we have built and enjoyed in recent years. We have a good, and also I think last summer meeting, Chicago was the first NCOIL meeting I've missed since I've been in office, and I think Will has forgiven me for attending my mom's 90th birthday instead. Time heals all wounds. But I heard it went great. You guys had a number of our officers at that meeting, and we also have a great mix of regulators here, as you just heard from Patty and Montana. James, here we've got some newer members as well as some more seasoned members with some of us here. So we look forward to the conversation, and thank you for the opportunity again.
Thank you. So let's start our discussion with the NAIC activities related to AI. And let's start with the NAIC's request for information regarding possible development of an AI model law. When we last met, the NAIC was still reviewing all of the comments and having initial discussions. The NAIC's RFI can be viewed in your binders for the legislators present on page 119 and on the website and app for everyone attending. Since that time, we do understand that NAIC has had some formal and informal meetings and discussions about what the best path forward would be, and it does seem that there might be a bit of an impasse as to what should be done. I think we're kind of feeling the same way here. If folks had been to the meeting earlier this morning, I think that we're all just kind of struggling is what are we going to do relative to AI? It's not going away. And so our respective organizations need to offer kind of guidance for opportunities in terms of legislation and regulation. So if you could speak a little bit to where you are with the AI RFI.
Well, thank you so much, Madam President. You know, we, like you said, we've struggled with the scope of discussions, and the discussions have been all over the place, especially as we focus, you know, regionally and really the impacts on AI. We know the AI tools, machine learning tools, are already being quite widely utilized in this market. And many of us have been we want to make sure that we get we're getting the bulletin out, and I think we got it out to 17 states have published a bulletin, and as a general, basically a principle of where the commissioners are looking at, you know, the proper uses of AI. And I think the good portion, I think the majority of the commissioners are going to be waiting to get more socialization of that bulletin out before there's really a serious movement for really recommending a model law. And we're, of course, very, you know, respectful of the role of legislators in this space. And so we're really looking at working together with NCOIL and to see how you all see this space, because we want to be careful that we are not stymieing innovation.
Right.
But we also want to make sure that there's a human being involved in critical decisions, whether to deny a claim or to refer to, for example, fraud referral. And so we're very sensitive to that. And I think that's why we're struggling. And of course, now the federal government wants to engage in this space as well. And so we're sensitive to that. And we don't really, personally, I don't want to get ahead of our legislature. I'm very glad that both our chairmen of insurance committees are here, Chairman Walker and Chairman Lumsden. And so we have a lot of discussions about that here in Georgia, and we want to make sure that we're not rushing to failure.
Yeah. I just think across the country, I think states are just struggling, and the technology is obviously moving much faster than the work that we're able to produce either via legislation or by regulatory, you know, bulletin or memos. And we don't want to fall behind, but obviously we want to make sure that we're having protections in place in a kind of world that this technology speak isn't what we are using on an everyday basis.
We're also having to develop, even because of the form filings are getting more and more complex, more using AI tools, that we as regulators are having to develop AI tools to examine these forms because they're getting so big and so complex that we couldn't staff quick enough with the talent quality that required to examine these filings without some assistance that machine learning can provide us. And so we're very sensitive to that, very careful balance. But protection of the consumer is the primary focus, but also making sure that we don't stymie innovation in the industry.
Yeah.
I might just add that I think the emphasis from many of the states as far as where to go next was to sort of hit a little bit of a pause and push forward with the bulletin that's out there. We've had 24 states that have put out the AI bulletin, and so I think we're looking for more widespread adoption of that bulletin before taking big steps forward. Thanks.
Okay. Are there any questions or comments from any legislators relative to AI and NAIC? What about the NAIC proposed systems evaluation tool? I guess that exposure draft can be viewed on the website and app as well. Can you provide any kind of summary, the goals of what the goals are for the evaluation tool? No? Okay.
Sorry, I don't know that anyone's
No.
prepared to answer that. Dan.
Well, I think, yeah, I just realized, I had to think through, that came out of H committee as well.
Okay.
In basically evaluating, basically setting up a set of principles that we can evaluate the use of AI tools to make sure that, you know, that they don't cross any thresholds of discrimination or improper. And so we're inviting tech companies to come and do presentations to talk about what principles, what governance they have, and to try to establish a common view of that. And so we're really looking at tech companies doing presentations and see how they're viewing this, so we can obviously become more knowledgeable how this use of tools are being implemented.
Do you think that there's any uniformity that can be kind of the baseline for something like that?
That's what the bulletin wanted to address, is that we wanted as regulators tell companies, this is our principles that that we want you to be mindful of. As you create this, don't forget that these are the principles that this bulletin. And so that's why we wanted to push this bulletin out to as many states, so at least the industry knows what is the examination tool that we're going to be using to rate how the proper use of these tools.
Okay. Any questions?
Assemblywoman, just a quick comment on that. I think that's the idea, is to standardize that. But then just one key point, there is a meeting on November 19th, an open meeting where they'll be unveiling, I say unveiling, but bringing out the new version. And so that's open to the public on the 19th.
Representative Carter?
Thank you, Madam Chair. What's the status of the evaluation tools at this point? Have they been implemented, or are they still in theory? What's the status?
No, it has not been implemented. It is, number one, it's optional for all regulators, but it is just a way to have a standardized way to review those AI processes. And the other key point there, I think, is I just mentioned there's a meeting November 19th. So what is that, next Wednesday, I think, will be a meeting to roll that out.
Thank you.
We kept comments open to September.
Representative Riggs?
Thank you, Madam Chair. I'm from Colorado, and in Colorado, we have been the first in the nation to adopt AI policies to regulate, the use of artificial intelligence in underwriting and anything in Colorado. We're looking at the liability specifically for deployers and people who are the users of the algorithms or the coding that will come out. And there's been a lot of dispute back and forth between big tech and how and who is going to be, responsible. But I think that should be a basis for what we're looking at when to see who to hold accountable if there's discrimination, and to ensure that there isn't discrimination, but if it does happen, who do you come after as far as liability?
Well, we license insurance companies. Those are the folks that we're going to hold accountable, not tech companies. We don't license tech companies.
Okay, as long as someone's responsible.
We will hold insurance companies accountable.
I'd like to add just a couple of comments, Madam President, to that. So in Washington, we do know that some of the insurers are utilizing tech companies in data gathering, and if they're acting as a healthcare benefit manager, processing claims, that sort of thing, we do have the ability to regulate them. So there is some nuance here when it comes to the tech companies. We actually, at my office, we formed an AI advisory board to look at two things, how we can utilize AI systems internally. I mean, we're already using some, but we don't want to get into the high-risk systems that the EU has banned, that sort of thing. We want to stay clear of that, but we also want to know how we can use it internally to improve our processes. But we also need to know how it's being used in the industry. And we don't regulate underwriting in Washington State, but we do regulate the rates, and we monitor that. And right now, based on our understanding, it's not being used in the rate setting. It is in the underwriting piece. So we're struggling with that as well, but I'm hoping that our AI advisory board will help give us some clear recommendations on how best to improve transparency when it comes to utilization of AI systems in the industry. Because like Commissioner King, our charge is to make sure that it's not being used in a discriminatory way. And right now, I don't know that we have the tools to be able to determine that.
Okay. Let's move to discussion on federal matters impacting the insurance market. I think there's probably a lot to talk about here. So let's first discuss healthcare developments. When we last met in July in Chicago, we discussed the recently passed federal reconciliation bill and how there were so many questions relative to Medicaid, the exchanges, and other matters at that time. Here we are in November, a couple days removed from the longest shutdown in history, and we have maybe more question marks. So there's a lot to discuss here, but I'd like to hear your perspective on where you think things stand in the states and in terms of things like open enrollment and what you and the NAIC are hearing from consumers.
Thank you, Madam Chair. You know, I didn't show up for one NCOIL meeting. I left this task for you to take care of while I was gone, and nothing got fixed. Yeah, there is a lot happening in the health insurance space. Certainly up in the forefront of mind and conversations on folks, maybe like never before, just due to the shutdown and the hang up on that. You know, the funding of the bill. Just, you know, I literally feel like I need to check my phone now to see what update there was since 8 o'clock this morning. But we've been, you know, we continue to monitor. We sent, I believe we sent 4 letters, maybe 3, this year to Congress from the NEIC, encouraging the extension of the tax credits and the impact that that would have on our states, or the termination of those. You know, they were originally put in place in 21 and extended to 23, and then extended to the end of 25. So it's the old proverbial kicking the can down the road, but here we are. And you know, what we have talked about some, and I will speak for myself at least, at the federal level, was some type of a step down or gradual glide path of those, as opposed to a hard cliff here come 12/31. I do know that there are some conversations going on now. You know, I think most states are estimating that if those are terminated as is, we'll pick a number, 25-30% of disenrollment in those states, and the ripple effect of that. I know I did a op-ed back in end of February and sent a letter to our state leadership just kind of talking about the ripple effect of that everyone knows the premiums will go up for the individuals, but then the uncompensated care that goes out to, at least in our state, an already fragile rural hospital system. And so there's just a lot engaged with that. We, as far as those letters go, at the NEIC, I requested earlier this week that maybe we send one more letter, and really just with the message that it's never too late. That's my words, not what the letter says, but that if they're going to do some sort of extension of those tax credits, the sooner, you know, that, because what we are hearing, feedback from DC was that, you know, the open enrollment's already happened. We're past November 1st. It's too late to do anything for 2026. And we're trying to drive home that message that that is not accurate. It's certainly not ideal. The way this should have been, you know, dealt with 8 months ago, but it is not too late. And so we actually will take a vote, probably an electronic vote on Monday for that, and hopefully get that out the first of next week. The Senate Finance Committee, I know today, just has scheduled a meeting for Wednesday to discuss alternatives and what they'll take a look at doing with those. But we continue to monitor and continue to push. You know, we have here on our panel here, it's an interesting mix when you talk to about the federal exchange versus the state-based exchange. You know, we've got kind of split here on who is in the federal exchange, who's in the state-based exchange. And, you know, in Oklahoma, we are slowly moving to a state-based exchange. Got that through our legislature last year to try to give us some more control. But even at this time frame where we would have been moving ahead, but so much was up in the air, as far as what's going to happen with those tax credits, what's going to happen with enrollment. Or, you know, in Oklahoma, we've got a little over 300,000 people on the marketplace. I know John here in Georgia, they've got about 1.5 million on their marketplace. But if you're trying to make some decisions based on, you know, establishing a state-based exchange and the revenue that comes with that, are we going to have 2/3 of the people enroll and 2/3 of that revenue, what does that look like? So we have sort of just slowed down our process, but on this panel, you've got a good mix of folks that are on a state-based versus a federal exchange.
So when we were at the meeting in July, we talked a little bit about the rate increases that would be forthcoming, and I guess now it's come to call here. So what percentages, and I guess that was some of the questions we had in July, what kind of guidance are you giving carriers? They're going to be asking you for rate increases, and it seems like they are asking for significant increases. And how does that, on an everyday basis, what does that look like? What can the consumer expect January 1 based on where we are right now? If we can even give some kind of view into that.
Well, we'll let others speak here, but I know in Oklahoma, our weighted average of our plans is 29% weighted average increase. So we're working a lot on education to the consumers about alternative plans. So folks moving from a silver plan to a bronze plan, but even also other alternatives off the marketplace, or this perspective that having some type of coverage is better than no coverage at all. So I think there's a lot of education happening in our states, but I'll let the panel speak.
I will tell you, Madam President, that if you ever needed a reason to start a state-based exchange, this experience screams it at the states. It has given us the opportunity to be a lot more flexible, more adaptable, to be able to get insurance companies to put more options on the table that you would get on the ACA. And so our focus on our marketing is because the rates had to be published at least a month ago. October 1st, we let people go and window shop, not select a plan, but to start looking. And we're averaging about 20 in the 20s in rate increases. But we've been able now to be able to offer more plans in other categories, silver to bronze. You're looking at allowing agents to talk to the customer and ask them, okay, you used this much insurance last year. Perhaps you were more suited for this plan, which is a lower, and so it gives us the opportunity to really market and not just react to whatever the federal government does. And so we're in a lot better spot than we would have been had we stayed on the ACA, because we can control the marketing, we can give options to consumers to keep them in the marketplace, which is my focus in this open enrollment, is keep people in the market, to make sure they're not just dropping all insurance and going to emergency rooms to get their health care provided, which is the most expensive, most inefficient way of delivering health care to our nation.
In Montana, we're experiencing about 21% increase. We have 3 carriers that participate in the federal marketplace, providing insurance to about 66,000 Montanans, and that seems lower than the other states, but you have to keep in mind we're a small state, so it is a significant portion of our population. Like Commissioner already here, I also wrote an op-ed this summer for newspapers in Montana, urging Congress to extend the enhanced premium tax credits, 2 bases for that. One is to provide certainty to our insurance companies, at least through the year 2026, and then secondly, to keep insurance affordable for many working Montanans. I agree with my colleagues. We did discuss this morning at the breakfast we had, that there has to be, at least in my opinion, some kind of glide path if Congress decides not to move forward with the enhanced premium subsidies, so at least a year or something to provide some certainty both to the carriers and to the insured. Second thing is aspect that you would be interested in as legislators is there's a cost to our regulatory agency when the federal government engages in political showdowns like this, because as the other commissioners I'm sure would tell you is that we've had to engage in about 3 rate reviews because of what's happening in the federal government, either doing rates either with the subsidies, without the subsidies, and then of course litigation that's happening in federal court, say around the integrity rule. And so it has an impact not only on the workload for my staff, but also the funding that's provided to my agency by the legislature.
So, the rate increases vary across the states based upon whether or not you're a state-based exchange or a full federally facilitated marketplace. I think Georgia's is a little less than 25% on rate increase. I'm not sure what yours is, Glenn. Ours is 40.9%, and I was with two of my other colleagues at a disaster conference, Louisiana and Alabama, and I got a text yesterday at 4 o'clock from Tim Temple, the commissioner in Louisiana, 51% rate increase from Blue Cross Blue Shield and the ACA. So what you have to look at as a regulator are what are the cost drivers, and that's the main thing that you've got to look at. Why are the rates going up, and what do we do? And those cost drivers are things like PBMs, which we don't regulate, and Farmer owns Congress, so I don't know if we're going to get any help there at all. And you gotta understand this, guys. 35 to 40% of your premium is owned by the pharmaceutical companies. It's not the medical profession. And the docs are all in the boat now that they're being bought up by the hospital corporations, and they control what they want on networks, and that's a cost driver also. And then you dump, now it depends on what state you're in. We're looking at dumping 66% of the people that are presently in the ACA back into the uninsured market, which means that you're going to have 200,000 plus people going into a hospital for uncompensated care. And when that happens, the hospitals are going to close the emergency rooms if they can get away with it, and you're going to end up with no care at all. You're going to end up with healthcare deserts. It's an issue that's got to be addressed different. The systemic risk really involves the risk factor, and you've got to address that. And back to the credits, that's the question. I get off on the rabbit trails because I'm pretty passionate about this. The issue for us is where do we stand on the tax credits? And when my two senators call me, and they're pretty safe, we're in a red state, and say, what's your position? I said, we can't continue this model forever. Somebody's got to have some skin in the game. And you can't continue giving free everything to everybody. Somebody's got to pay for it. So we've got to have a glide path. I'm probably the only person up here that's going to say you got to be careful of accepting the tax credits. We're just going back to where we were 4 years ago. And you can get people, if you can educate them, to buy down into the bronze level. It's not good insurance, but it's better than nothing. Or we've got to open up your high-risk pools, which most of you as legislators have killed. Not Texas, thank good, Tom, for y'all. And we didn't kill ours, so we've still got the ability, but the problem is CMS will not give you the 1332 waiver that you got to have to open that up to provide health insurance to the people that really need it. It's a downhill spiral if we don't address it. And you know what? Who's going to catch the blunt of it? You are as a legislator. You're going to be the ones that people are going to look at. Now, that's way more than I was supposed to say. Glenn said, Cheney, don't say much.
We didn't see him kicking you underneath the table.
It hurts too.
Madam President,
Yes.
we have on average a 21% increase. Roughly 7% of that is related to the expiration of the enhanced premium tax credits. We're going to see about 80,000 people will drop coverage. Most of them will be strong and healthy. When we spoke with, we're a prior approval, we're approval state, prior approval. And when we asked the insurers about what their reasons were for the rate increases, they were pretty unified in 4 major factors, which were increased utilization, which we're going to see if the enhanced premium tax credits expire, consolidation, PBMs, as Commissioner Cheney pointed out, are huge drivers, drug costs, and the uncertainty coming out of the other Washington. So I think we can all agree, no matter what side of the aisle you're on, that the system's not working. It's not working for patients. It's not working for providers. I heard that loud and clear. And it's not working for our rural hospitals either, quite frankly. So there probably is a better way. We did an emergency rule earlier this year, premium alignment, that we hope will reduce that 80,000, hopefully by between 30 and 40%, if we're lucky. But that's what we're hoping. So we are encouraging people. We are a state-based exchange, and quite frankly, the state-based exchange, the ACA allowing state-based exchanges, and the enhanced premium tax credits reduced our uninsured rate from around 15% to under 5%, which has really helped stabilize premiums to some extent in the state. So, you know, it depends on your perspective on how you look at the enhanced premium tax credits, but they've been working pretty well in Washington State. And so I've been encouraging our delegation to work very hard to extend them. And we do need to figure out a better way. We're in conversations about 1333 waivers. And we've reached out to other states to talk about how states can work collaboratively to help make sure that folks can access health care, because it's a good investment. We don't want people using, as Commissioner Cheney talked about, we don't want people using the emergency rooms to get their health care. And it's good for the economy, quite frankly, too. So we actually see an economic benefit from investing in those enhanced premium tax credits. Thank you.
If I can, yeah, and just as a, add to that, 1333 waivers, if you're not familiar, they allow the states to compact together. That's really what they're talking about, that 1333 waiver. I think our fear, my fear certainly, but our fear that we could use your help with too is that we're now at, what are we, November 14th today? So we're a couple weeks into this. The fear is someone goes to the open enrollment, they go to see what's happening with their plan, they see that large increase, they bail out, I'm out. And now the problem is, I don't know, next week something changes and something's available to them, educating them, can we get them to come back in and take a look at that and to actually enroll? That's the fear, is trying to, so legislators, I think, can really help in helping educate the public if something does change in a positive manner to help them enroll.
So just one quick thing. I think most of us would be very concerned if these tax credits go back to the insurance companies. They're using it as a profit center. They need to go back to the consumer, and that's who we're trying to protect here. And it's going to take a lot of us working together to figure this out.
I think we have a few questions. Representative Oliverson?
Thank you, Madam Chair. I heard Commissioner Kuderer say that 7% of the increase is due to the expiring tax credits, premium subsidies. Is that standard for all of you? Or, I mean, what's the, because that's lower than I thought it would be, right? I mean, I think we have this impression that, oh my gosh, 21%, 60%. Well, that's just because of these credits expiring. But it sounds to me like the majority of the problem is still utilization, consolidation, the same factors that we've been dealing with for the last 20 years that continue. I don't know, have we ever seen a year where we actually saw a decrease? I mean, I think we've had some level years, but. So I was just curious if that's y'all's experience across the country, that it's a percentage of the increase is actually the expiration of these credits, and if so, kind of is 7% kind of what you're seeing?
Yeah, it's 8% in Montana. You identified some of the primary cost drivers for us in Montana. It's provider inflation, double national inflation for what our providers are charging, and then of course specialty drug coverage are big factors as well.
Well, the factors that we see depends on what part of the country you're in. A lot of them are pharmaceutical benefits, and we have more and more people demanding that they get a drug that costs $60,000 or $70,000 a year. We've started covering a lot of drugs for heart diseases that are just out of the crazy, and then you got the GLP-1s, you've got bariatric surgery. You just put all of that together, and those are cost drivers that drive you up. So when you try to quantify what portion of this is due to providers and what's due to pharmaceutical and what's due to actual inflation. It's a combination of all of them. But a 40% increase, 7% of it is affected maybe by, I think our number's a lot higher, the tax credits. But tax credits accumulate in a poor state, they're extremely high. Ours are close to 27%. I shouldn't have told you that, but that's how much they are. And so you're affected a lot. And on the political side, and we're all politicians in the room, most of us, you've got to remember that the Republicans, if they don't fix it, they're going to lose at the box in midterm. Now it's too late. The blue states think we've got it now, we can fix this problem. So I predict that we'll get some type of credit. We just hope that it will be a glide path. That's instead of cutting them out, just cutting them off in the morning. And I think we talked about that, Madam President, this morning a little bit, but the other folks need to hear that.
Yes, they do. Thank you.
And they can help us. You've got to talk to your congressperson and your senator, and instead of them trying to hold the line for one person, they got to think about the people that elected them.
Senator Lang.
Thank you, Madam Chair. Thank you, Commissioners, for being here. I would like your response to my assertion that the ACA is actually designed to increase cost for the exchanges, and here's what I mean by that. We know for a fact if you have an actuarially sound health group, meaning you have 1,000 man-years in that group to do full underwriting, we know for a fact that people with full insurance in that plan, about 30%, do not use their insurance policy at all. They're young, they're healthy, they don't even go to the doctor once a year, and insurance is designed so that those young, healthy people are paying into the system to support those old folks like me that are high utilizers of the system. And Pareto's law, the 80-20 rule, is real in insurance, but for insurance, it's even worse. In insurance, 4 to 6% of your belly buttons are 60% of your claims. You still have 20% of your belly buttons that are 80%, but it's 4 to 6 are driving the cost. And the ACA is designed with no pre-existing conditions that young people today have no motivation to enter the exchanges. I have a 42-year-old daughter. She is uninsured. She said, "Dad, why should I be insured? As soon as I get sick, they have to take me and they have to cover me." So my assertion is the ACA is actuarially designed not to fail, but to drive cost up on the exchanges. I'd like your assessment of that.
I'll jump in on that just for a second. That you've just identified the problem with the tax credits going away, and the real concern, and that is that's who's going to not become. The person I just talked about in these last 2 weeks has logged on and seen the increases. They're young, they're healthy. They're going to say, "I'm out. I'm not going to participate." And so I think, in a bigger picture way, we need to think about how do we engage young, healthy people and keep them in that pool. They are needed in that pool, as you've illustrated. And I think too, I've got 3 sons, 22, 23, 25. You know, they're Superman, never going to be sick. And indeed, pre-existing conditions, they can come on without that. However, it also does have to be during the open enrollment. So that total loophole is somewhat closed. But you've identified the problem in how do we keep young, healthy people in the pool?
And we have a couple other questions. We're going to go to Senator Utke, then Representative Dunnigan to close this portion.
Thank you, Madam Chair. And this probably isn't so much a question, but a comment as we are listening to the discussions here. And we're talking about all the different cost drivers, but the one thing I haven't heard much of, and somebody touched on it just a little bit, and that was legislative action. And when you come from a state like I do, where they love to push the costs onto the insurance companies, et cetera. Just this last year, they raised fees over $1 billion in the last budget on providers. So that's going to drive up the cost because they don't absorb those. They got to pass them on to us. And then the mandated benefits that have been passed the last few years have driven up the cost of per member per month by $30. So when you add all those things up, some of these increases, and we're hearing all the other things that come into making sausage out of this whole thing, but part of it is our legislators and what they're doing in their respective legislative bodies. And I know some of you are a whole lot better off than where I come from, but we are not helping the problem either. So this gets dumped on the insurance companies' heads, and it's not all their fault. But, you know, we got a problem. Thank you.
We would agree with you on that, but, you know, our job's not to kiss up to the insurance companies. Our job is to protect the consumer and be a good regulator. We're not in the policy side, the legislators are. And what we need from legislators is a good statutory law without mandates, because insurance is based on risk. The premiums are based on risk. And if the risks go up, rates are going to go up, premiums are going up. If doctors demand, not doctors necessarily, but consumers demand more and more service for paying a $500 a month premium, and then you want $5,000 a month in benefit, that's not going to happen. That's not a sustainable model. And when you look at adverse selection, which we're going to, that just means that the healthy people are going to get out. The people that are left in the ACA are sick people. And you look at trying to establish a state-based exchange, it's hard to do that today, because to make that exchange work, you've got to have some type of income. So in John's case, he's got 1.5% off the top. Is that what you operate on, John? About 1.5%. If you're new in this and you're using the facilitated marketplace to do your state-based exchange, you can't run it at that. It's a lot of sugar for a nickel, because you can't, you think about it. So the insurance companies are just a pass-through, and you got to have everybody in the pool, or it's not going to work. It's pretty simple, really. It's about money. You know, life, I say this, and my wife's not in the room, thank God, but life's about money, power, and sex, not necessarily in that order, and a little theology thrown in.
Representative Dunnigan.
Well, I'll just say that the good commissioners sounded more like a policymaker than a regulator. And I hope things are well at home for you. So, I want to follow up on Senator Albertson. You know, intuitively, with all the media, you'd think that without these subsidies, the piece of the increase would be much greater than 12 or whatever it is. But as Commissioner said, remember, the subsidies were taken back to where they originally were 4 years ago. So it's not like it'd be a much higher piece if the subsidies were completely gone. But we still have the original subsidies that came out. Secondly, just a comment of, let's give the money to the consumer. The consumer already has the money. They don't have to use it as an advanced premium tax credit. They can let it sit there, they can pay for whatever product they want, and they can take it on their tax return as an increased refund. But if we're going to give it to the consumers, many consumers are not sophisticated shoppers for health insurance. How are they going to have the mechanism to go and apply that to the policy different than what we have now? Can they use that money if we give it to them for something else, such as a big screen or a trip somewhere? Even with a penalty, they'll do that. Maybe you can't do that. But the question I have for you is on 1332s. It sounds like the feds are not going to approve 1332s for risk sharing going forward, or new approvals. What about states that are already doing the 1332s to do cost sharing when their waiver comes up? Do you think they'll be renewed or not?
I will tell you that our conversations that with the federal government on our waivers have been pretty positive. They're willing to listen and look at them. They're not gonna give us. They want the states to experiment and innovate. They really, this administration seems to be able to want to give that bandwidth for the states to take more of this and take it away from the federal government. So I'm encouraged. We're looking at how we're going to develop our waivers for the renewal, but we've used ours very effectively, and it's given us the latitude to be able to innovate and not be responsive to the noise from Washington, D.C., and actually take a little bit more control over our destiny.
And in our state, we don't have a 1332. We are stepping into that water as we speak. But I will say too, from the federal administration, they are very encouraging to be creative and innovative with 1332s. My colleague from Washington mentioned the 1333 waivers. Those have been pushed pretty heavily by Peter Nelson with CISIO. I mean, that's what he's talking about constantly. So there's a lot of creativity and flexibility being pushed out there.
Okay.
If I might, one final thing, just back to Senator Utke's question from Minnesota. Just, everyone probably knows this, but, you know, in statute, any mandates that were passed post-essential health benefits were supposed to fall onto the states to pay for that. And so states that have passed a number of mandates outside and over and above that, now that has not been enforced. They've not been held to that, but there is talk that may be coming. So that's something that you should be thinking about and sort of probably quantifying too.
For legislators here, we do have a representative, Peter Nelson of CISIO. I guess he works with states on the 1332 waivers, and he's speaking at our state federal committee meeting later. So if there are questions about that, we do have someone here who can answer questions and speak to that. So moving on, as we're talking about the sky falling, I wanted to talk about the National Flood Insurance Program. Yes, sinking and swimming. So the fallout from the government shutdown was that the NFIP is lapsed. That meant no new policies could be issued, and existing policies couldn't be renewed until Congress reauthorized the program. This is obviously made worse by having this occur during hurricane season. And I suppose to no one's surprise, the NFIP was included in the recently passed spending bill, but it was again reauthorized on a short-term basis. Both of our organizations have long supported long-term reauthorizations of the NFIP to avoid situations like this. Needless to say, this is a terrible situation for everyone involved, and we're curious, what has NAIC been hearing from state insurance departments in terms of consumers reaching out to insurance departments about flood insurance? Has the private flood insurance market responded well to this? And do you think this will now finally motivate Congress to enact a long-term reauthorization of the program?
Okay, on to another lighthearted topic. Yeah, we've, 33 times, I believe the number is, that we've had these short-term extensions over the last 8 years. And we have continued, as I think all of you have too, to push for a longer-term authorization. I chair the FEMA advisory group for the NEIC, and I had a call with Bob Fenton, who's the Region 9 guy. They were tasked as of January of this year by the president to take a look at all that, and there's a report due back in December, next month, from that. So from that, there was a call in mid-September that I was on with them, and they were having a roundtable meeting at the White House on September 30th. I was not able to attend, but a handful of folks did, including our President John Gottfried led that contingent, and our team's focus was on long-term authorization, something at least 10 years to encourage private market growth. A number of our states have seen some good growth in the private market of flood insurance, but certainly would like to see more of that. The issue of, if someone moves to the private market for flood insurance and then tries to go back to the NFIP, they're basically penalized for that because they're seen as though that coverage lapsed, but it didn't lapse. They went to private coverage. So that's a little, loophole or something that we sure like to see get fixed. Mitigation incentives was another focus. And then mapping and modeling, sort of investing in that, and then just more consumer education, as is always needed with an FIP due to, I think in all of our states, a very poor, very low percentage uptake on flood insurance. So that was just September 30th. I think those sort of the highlights of what's happening there. There's a big question about FEMA funding, and I think there's thoughts of things we push down to the states, and does that mean responsibility and funding, or does that mean responsibility with less funding? So that's an unknown right now. I know I've had 2 meetings with our emergency management trying to just plan ahead, and okay, if funding is cut substantially, what do we do? What do our towns and communities do And specifically in our case, it's about infrastructure. You know, they have their insurance coverage for their buildings and their property and their liability, but what about when a road or bridge gets washed out and there's no federal money coming to replace that? So we're taking a look at that, and we're right in the thick middle of that. So that is sort of the high level of what's happening with NFIP.
I think Representative Lehman has a question.
Thank you, Madam Chair. So I've not been here for that many years of these extended resolutions, but the issue is down to this. It's not working, period. Extending it for 10 years, it's not going to work. If you remember, I think right now, NFIP is $20 billion in debt. And if you remember, back in 2017, they were $16 billion, and they wiped it clean. So if you wipe it clean again and start over, where are they going to be 10 years from now? The issue is you've got to get people in a room who say we have to find a long-term solution that does not involve the federal government being $1. That does not work. I think after 9/11, the industry came and said, look, we can't handle another terrorism claim, and what came out of that was TRIA. And they said, we'll absorb a box of this, but then the industry says after that, they got to take the risk. Why is that not a model the feds are looking at with flood? You know, the industry can underwrite this if you give them a cap. When you give them a $10 billion exposure, it's going to be very difficult. But if you limit that, everything above that, the feds can pay for. Everything under it, let the private industry pay. Okay, so you've got to come up with some solutions beyond extension. It's just not working. You're going to have issues where a state like Indiana, which we're getting hammered by hail, Minnesota's getting hammered by hail, you know, and other states are going to go, we don't have a hail problem. Well, Edmund's right in front of me, and he has hurricane issues. We don't. So the issue around weather and hurricane and flood has got to be a better solution. Florida has one of the most aggressive private flood markets, and it's not working. It's not working. So the private market can step in. But when you get into, you talked about the loopholes, there's going to be things around who can, when you can't, what's the rate going to be. And you talk about people not affording health insurance, they're going to walk away from flood insurance. Now you've created a lending crisis, a massive lending crisis. All this is tied together, and extending it for 6 more months I'm preaching to the choir, I know that. But I think we as legislators need to get hold of our members of Congress and say, stop extending something that's a broken system to begin with. It's not working.
Representative, I will just say amen. I mean, 100%. And you know, from my notes from that mid-September meeting, that deficit is $26 billion, at least is what they quoted to me into that meeting. They also talked about addressing the 5% of policies that have repetitive losses. So but to your point, that's sort of patchwork to something that probably isn't working, and I think the TRIA is a good model for them to take a look at.
Do we have any additional questions about this topic? Okay, let's move on. I know we don't have a lot of time left here. Let's have a discussion on updates to the risk-based capital framework. We're aware that NAIC has undertaken a major overhaul of its risk-based capital framework with the goal of modernizing solvency oversight. It's a big change that will have significant impact, and we're curious what led to the decision to make these changes and what the comments have been like and what the timeline looks like to finalize your work.
You know, one of the factors that we started looking is investment companies in looking at how they're invested in insurance. And so that really was the impetus for the NAIC to start looking about how we treat investment, I don't know, for lack of a better word, you know, we were traditionally looking at RBC, risk, and looking at how money is there collateralized to handle risk. But when you have, Bitcoin, you have all these other investment vehicles coming in, we have to relook at how we assess the capital to be able to pay claims. And so that's what's caused NAIC, and we got some incredibly talented commissioners and staff looking about how do we see all these investment systems who are now playing a part in insurance, and how do we collateralize? How do we account And how do we audit it? Because that's the hardest part of what we're facing, is how do we go into, as state regulators, how do we go into a company to audit what assets they got available to pay claims? And so that's kind of went over the world on how we see, and so I don't know if any of the other commissioners want to add on to that.
I'll add on a little bit. I actually sit on that task force, new to it, obviously, but I can tell you that based on my understanding is there was some requests from the industry to look at the RBC methodology and did it need to be updated? That was kind of part of the thing too. And I think it's good to review formulas over time because things change. So that was really kind of the impetus behind it. And there's been 2 public comment periods. We just finished the second one. But the second one was as we had narrowed down what was being looked at in terms of risk-based capital. The main thing was that they wanted to keep it tied to solvency and not include things like we're going to include whether or not this is going to impact new product ideas and things like that. There was a lot of uniformity around that should not be included because of what risk-based capital is all about. But the 9 proposed principles emphasize the updates to RBC levels. We've recommended these. This was on the second public comment period, but they needed to be material, which is the threshold at which RBC update could meaningfully impact a regulator's assessment of solvency risk. They have to be objective, they have to be accurate, grounded in statutory accounting and reserving, transparent, that was an important factor, reflective of equal capital for equal risk, and inclusive of emerging risks, and subject to a clear and repeatable process and prioritized. So those were the 9 principles that were emphasized in the second public comment period. We only got 8 comments on those, and I think at this point we're going to be taking it up at our fall meeting to make a decision one way or the other. At least that's my understanding, and that we're going to be talking about the latest draft and the comments received. So that's where things stand right now. And since I am new to it, I honestly don't know whether or not we'll be taking a final vote on it at that time, but that's what's happening on December 3rd, if people are interested.
Okay, I think we'll be looking forward to see the outcome of that is at our spring meeting. 8 comments probably is not a good pool to maybe put guidelines by, so I don't know if you're going to have another call or waiting for more comments to come in, but it's funny, you're talking about emerging, how do you assess emerging risk? And by the time spring comes, technology will be had advanced 6 more months, ahead. We're already behind. Yeah. Are there any questions on this topic? I think we have time, I think, for one more area here, and it's relative to the NAIC's development of an affordability and availability playbook. The playbook was to aim to help state regulators address the growing homeowners insurance crisis. We're all feeling that now. The current draft can be viewed on the website and app. Developing the playbook is a big undertaking as the affordability and availability crisis is just complex. And as we know, there unfortunately isn't one single reform that can be enacted to fix everything. Can you provide us an update in terms of what the development has been like? Again, the proposed timeline for finishing it, and if it will be accompanied by any NAIC model legislation or regulation.
Yeah, thank you. I'm happy to start the conversation on this piece. So, like the commissioner from Washington, as you heard, I'm a new commissioner, new to NAIC. One of the committees I sit on, which I did ask for, is the Property and Casualty Insurance Committee, which is the C committee for NAIC. As indicated in the opening remarks on this, we are working through that committee on developing a affordability and availability playbook. Certainly we have heard through our hour discussion here about affordability. The one thing that we haven't touched on is availability. All of us as regulators want to make sure that there's plenty of coverage in the market to make sure that our constituency, if you will, is able to get insurance in the first place. That's one of the legs of the stool as we, as regulators, have to deal with in Montana. In the western part of the state, which is heavily timbered, as you can imagine, we are hearing of insurance companies just non-renewing policies because of perceived wildfire risk. Again, the playbook is designed, as I think has been explained, to assist you as legislators and us as regulators with messaging and addressing affordability challenges. We did release a revised outline for this document October 14th. We encourage you to take a look at it, and there's some good information in there that you can use to communicate with your constituency. And hopefully we'll adopt a finalized version of this when we have our fall meeting, which is in December, which is interesting to think about, in Florida in the coming weeks.
Are there any questions? Comments? Concerns? Okay. I think we're going on to noontime. It's going to be lunch. And we're going to conclude this committee meeting. Is there any other business before this committee? Okay, before we adjourn, I'd just like to note that immediately after this, we'll be having our luncheon on this floor, open to all attendees. We definitely hope to see you there. Afterwards, we'll meet back in this room at 1:30 for a general session on the lessons learned in the 20 years since Hurricane Katrina. So that should be relatable to the conversations we've just been having. And just want to put out there to all of you, especially for, I love this gavel. I use it all the time as Speaker Pro Tem in New York. Just wanted to remind all of you at 5:30 this evening, for every woman who is attending here at NCOIL, we do have our Women's Caucus reception at 5:30. So with that, I ask for a motion to adjourn. Second, all in favor? We are adjourned.